Welcome to PedsDocTalk TV. I am Dr. Mona, and for my first episode, I chose to talk about fever. Why fever is the number one reason we get phone calls in the middle of the night as general pediatricians, and it's also the number one reason you all go to the ER or come to our offices. So I thought it's time to spread some education about fever so that we can reduce fever phobia. Many times fever is not a cause for concern, and after this episode I hope that you feel more confident on when you should seek medical attention or when you should wait regarding fevers in your children. So in this episode we're going to be talking about the definition of fever, why kids seem to be getting more fevers than adults, thermometers and when to use those thermometers, the different medicines and when to use meds, also some myths about fever, and most importantly, when you should seek medical attention for your child and their fever. So make sure you watch the entire episode, and before we continue, hit that subscribe button because that's how you will get notified of all of my content and all of my educational videos coming your way. And make sure to follow me at PedsDocTalk on Instagram to continue the conversation. So we're talking about fever, and of course I have to put a disclaimer that your doctor is the most important medical professional for your child. So if your child has any underlying medical condition, I want you to talk to your doctor and say, hey doc, does this condition require me to notify you of any fever? Some medical conditions do. So you want to make sure you ask your doctor that. For example, things like sickle cell disease, obviously any of our patients who are oncology patients, these are important, and the rules that I talk about may not apply. So make sure you talk to your doctor if there's any other concerns. So first, let's talk about the definition of fever. The definition of fever is anything over 100.4 Fahrenheit or 38 degrees Celsius. I have many parents come in and will say, hey doc, my child has a 99.8 fever. 99.8 is a higher temperature, but it's not considered a fever. 100.3 is not considered a fever. We have to put the number somewhere, and so we set it as 100.4 Fahrenheit, 38 degrees Celsius. That doesn't mean that if your child has a 99.8 and is very cranky and irritable, that you just say, okay, I don't need to do anything about it. You can monitor that child, right? Check the temperature again. But I want to really put that definition out there because there is a number that we define as fever. So always remember 100.4 Fahrenheit and 38 degrees Celsius as we continue this episode. So why do kids seem to be getting more fevers than adults? One, their immune system is way more naive than ours. So anything, a virus, an illness of any kind, if we get it, we won't mount a fever because we've probably seen that illness before. If a child gets it, some children may not mount a fever, but some will. Their immune system is hard at work, and a fever is a sign of your immune system hard at work. Fever is the body's natural response to fighting something that they don't like. Fever causes a whole plethora of inflammatory agents that helps fight an illness. So in some ways, fever is good. Obviously, as we go through the episode, I'll talk about when fever is not so good, but it's important to understand that some fever is normal and some fever is okay for a child to have. And obviously, the number one reason children can have fever are viruses, but of course, things like bacteria, things like inflammatory processes can also happen, which is why towards the end of the video when I talk about when to be concerned, you'll kind of know, hey, I need to go to my doctor because X, Y, and Z is happening. It's their job to figure out what's going on. It's your job to bring your child in. So thermometers. Before we get into the thermometers, I want us to talk about something we call tactile temps. So a parent will come in and just say they felt their child and they were warm. Obviously, this is a good gauge. This can really give you a lot of information, but it won't tell you the number. I have many seasoned mothers and fathers and caregivers that come in and say, my child has a fever when I check it like this, but when I check the temperature with the thermometer, there's no fever. Absolutely, this is a good gauge, but it won't give you that number. So if you are concerned, you can use tactile temperature, but you have to confirm with the thermometer. One of the main reasons is that you have heat exuding from your body. So when you touch your child's forehead, of course they may feel warm because of your own heat. So you want to make sure that you confirm that with an accurate temperature reading. Now, what thermometer do you use? A lot of parents are concerned and they're like, well, I've gotten 5 different thermometers and they have 5 different readings. It can be stressful. The reality is it's more important how you check the temperature, meaning the part of the body, as to which thermometer you have. If you are so concerned that one thermometer is not working, you can buy another second one as a spare. We have 2 thermometers in our home. I encourage you to find a digital thermometer that allows you to check the temperature via rectal, so the bum, axillary, underarm, or oral, obviously in the mouth. So if you find thermometers that can do all three, you don't have to keep buying new ones, and if you are concerned, you can have a spare. So we have 2 thermometers in our home. They're both the digital thermometers with oral, axillary, and rectal readings, and we have one that we primarily use obviously for Orion and rectal readings, and then we have one in case me or my husband need to check a temperature. Now make sure, if you're checking a rectal temp, that you clean it before use and obviously after use as well with cold water, nothing very hot, nothing very ice cold. And then you want to apply a little bit of Vaseline at the tip. So this is an example of a thermometer, obviously. So you want to apply a little Vaseline at the tip, and you're only applying it to the gray area, and that's as far as you're going in. So when you're checking the thermometer, imagine that this is the bum. You are going into the bum, so into the rectum, and you'll hit the start button, and it'll start to read. It'll start to blip around, and then it'll start to beep when it's complete. Don't take it out until it's finished beeping. So once you take it out, you do the reading. If it's borderline, meaning under 100.4, you can check it again, and we'll go over, if it's over 100.4, what you will do. So rectal thermometers are actually recommended until the child is 3. I know what you're thinking, my 2.5-year-old is not going to sit still for a rectal reading. If your child is older and you just don't think your child will cooperate with the rectal reading, you can do it via the underarm or under the tongue. Under the tongue may be a little bit harder for a toddler because you have to have them sit still for a little bit, so you have the option of under the arm. When you're checking a rectal temperature, make sure you do it one of 2 ways. The most common way is laying the child on their back and lifting up their legs and inserting the thermometer that way. The other option is laying the child belly down on your lap, putting your hand on their back and using your hands to hold their butt cheeks, and then you insert the thermometer that way. Those are a couple ways to check a rectal reading, but that is recommended under the age of 3. So what do we do if we don't want to use a rectal thermometer? So if you don't want to use a rectal reading because your child's a toddler, that is fine. Like I said, you can do under the arm or in the mouth, but we do absolutely recommend, if your child is under 3 months of age, that you stick to a rectal reading. I've had many times where parents will check a forehead temperature reading on their 2-month-old or an ear reading on their 2-month-old, and it's falsely high or falsely low. So just go directly for the rectal temp, apply a little bit of that Vaseline, and insert it into the rectum for the most accurate reading. So if your child is over 3, or if you have a toddler who you want to check the temperature another way besides the rectal reading, you can do an oral reading. If they cooperate, you can do under the arm if they cooperate. The temporal thermometers that you see on the market, they all advertise themselves to be very accurate. The reality is a rectal reading is the most accurate. It's the most core temperature you can get. The temporal thermometers, the way they work, these are the ones that you slide across your forehead and behind the ear. The way they work is checking the heat from the temporal artery. Sometimes I find these can be falsely high if your child's been outside and playing, if your child is laying on that side. So just a little caveat about the temporal thermometers. Another one is an ear thermometer. So that's the one that you probably see at your doctor's office for your child, or maybe you have at home where you stick the thermometer in their ear. That picks up heat from the eardrum. I find that these and the temporal are not always as accurate as obviously your rectal being the best, your oral or your axillary temperatures. So that is an option. That can be a problem if your child has a lot of earwax, because sometimes it won't pick up the temperature as well. So definitely err on the side of using a rectal thermometer so that you can check a rectal reading if your child's under 3, or doing an oral or axillary or underarm if your child's more cooperative. So another question I get asked is, do I have to add a degree if I'm checking my child's temperature under the arm or in the mouth or temporally or in the ear? I don't do the math. The reason I'm saying this, and you'll get more information as when I go over when to be concerned about a fever, is that you don't need to do that if your child is older, because you're going to be looking at how the child's acting and the things that they're doing versus that number on the thermometer. If your child is under 3 months, you shouldn't even be checking a temperature besides doing the rectal temperature. So that is going to give you the most accurate reading. So if you have an older child who is, just say 2.5, it's okay if you get an axillary reading that says something. You don't need to add a degree and subtract a degree. Whether a child has a 102 or 101 as a 2-year-old is not as concerning to me as how they are acting, which we'll get into more. So now we're going to be talking about when to treat your child with fever. First of all, as a reminder, if your child is under 2 months of age and has a temperature over 100.4, which is a fever, you need to go to your pediatrician's office, call them, or go to the ER. Under 2 months of age, a fever is a concern. Why? because babies under 2 months, their immune system is much weaker and they don't have a blood-brain barrier that basically keeps things separate from the blood and separate from the brain. So we want to make sure that there's no infection that's coming into the blood, into the brain, and is this just a viral illness or is this something more? So under 2 months of age, please seek medical attention. 100.5, 100.6, 100.4 and above, please talk to your doctor's office. If they're not answering, go and get some help at the ER. So now if your child is over 2 months and this is the first time your child ever has a fever, you can absolutely call your doctor. I'm obviously educating you all on when to be concerned, but I don't want you to feel, well, Dr. Mona said this on her PedsDocTalk TV, so I shouldn't call my doctor. Absolutely call us, right? If you're concerned, especially if your child's 2 to 3 months or a baby, absolutely call us. We're happy to guide you through the process. But I want to explain when we would be concerned and when to medicate. So just say you have a 3-month-old with a fever. Call the pediatrician's office. They'll walk you through what to do. They're going to ask you, is your child unwell? Is your child staying hydrated? So if it's a breastfed baby, are they taking breast milk? Are they urinating and making wet diapers? Formula-fed babies, same thing. If they're past that stage and doing regular food and milk and water, we want to know if the child's hydrated. We also want to know if the child is breathing comfortably. And we want to know if that child is consolable. Those are the 3 main things I want you to look out for when your child has a fever. Is my child making wet diapers or urinating? Is my child breathing comfortably? And is my child having any difficulty being consoled? If any of those 3 things are happening, you can talk to your pediatrician. But just say your child has any of those 3 with a fever, you can go ahead and medicate. Medicine is not for the number alone. Medicine is for how your child's acting. And again, this applies for children who are older, right? Under 2 months, like I said, you're going to be talking to your doctor because they need medical attention. I'm talking about your 1-year-old child, your 2-year-old child. You check a temperature and you see it to be 101. I want you to evaluate that child. Are they fussy? Are they inconsolable? Are they not drinking as well? Then you can go ahead and medicate. If they have a 103 fever, but they're bouncing off the walls and they're consolable, you don't technically need to medicate that child. That child's temperature will come down on its own. You can do a bath, and again, you don't want to do a very cold bath. You want to make sure it's a very lukewarm bath. You can do a lukewarm washcloth on the forehead, but you do not need to medicate every fever. Fever reducers are meant for that child who's really not feeling well. And I give the example of adults. Just say you're sick. You're not going to be popping pills every time that you have a fever. You're going to be going over by your symptoms, right? You're going to be saying, I don't feel so hot. I feel achy. And then you're going to give a fever reducer or take Tylenol, for example. Same thing for kids. They may not be verbal to tell you, hey, I'm not feeling good. So you're going by their activity. Fever plus irritability, fever and not being able to be consoled, go ahead and medicate that child. I'll be doing another video in a couple weeks on how to calculate medicine dosing like acetaminophen and ibuprofen. But for now, you can use the packaging instructions or talk to your pediatrician. But this is important to medicate symptoms and not medicate the number. So when you hear someone talk about alternating medicine, not necessarily. When I go over my medication dosing, I'll talk more about this. But you don't need to alternate medicine. When we talk about alternating medicine, my opinion is that you're alternating if something is not due and your child needs it for discomfort. Let's do an example. Your child has a 101 fever at noon. You give Tylenol because your child is very uncomfortable. The next time Tylenol can be given is 4 hours. So at 3 o'clock, it's not been 4 hours. Your child is very irritable with the fever. You're going to give that child Motrin at that point. So you're not medicating to keep the fever down. You're medicating the symptoms, right? Because like we said, fever is not the concern. It's how they're acting with that fever that concerns us. So if your child is acting well with the fever, don't medicate. But if your child is unwell, then you're going to give that child some medicine to help them feel more comfortable. And as a reminder, I'll be going over medication dosing, so if that's something you want to see, make sure you add a comment in the comment section. But Motrin can be given, and that's ibuprofen, over 6 months of age. It cannot be given under that age because of the kidneys are not fully formed, so we like to wait a little bit longer until 6 months. It also cannot be given if your child has a platelet issue or a bleeding issue. Tylenol can be given younger. Sometimes we give that for children who've had circumcisions, but for younger children under the age of 2 months, you can give Tylenol. But remember, If your child has a fever, you need to be speaking to your pediatrician. So my advice is, if you're going to be giving Tylenol under the age of 2 months, let your pediatrician know so they can guide you as to, well, what are we treating here? And if over 2 months, you can follow the guidelines on, okay, how are they acting, what's going on, and run it by your clinician if you're unsure. So now I want to go over some myths that I hear about fever. So I do commonly hear that fever needs to be treated regardless of how the child's acting. And as I've said, that's not true. If the child is comfortable, consolable, somewhat close to baseline, interactive, you do not need to medicate that child. You are medicating symptoms. Get in that habit of medicating symptoms for a child. The other myth that we hear, all fevers are bad. No, not all fevers are bad. Fever is the body fighting something foreign. So our children will mount a fever, they'll fight something off, and then the fever will go away. Obviously, we'll go over reasons that we'd want the child to be seen if that fever persists for too long, if the child's acting unwell. Because yes, then we are concerned that that fever may be a sign of something bacterial that needs an antibiotic or something that needs further evaluation. But not all fevers are bad. I also hear that fever causes brain damage. No, fever does not cause brain damage. If the body temperature gets so hot, such as a child being left in a hot car on a summer's day, of course that is something detrimental to the child's brain. But normal fever does not cause brain damage. Of course, if a child's temperature from an illness gets to be 105, 106, that child is likely going to be acting unwell. You're going to want to medicate that child. But what you're going to be looking at is, how does that child respond once I've given the medicine? Are they responsive? Did the temperature come down a little bit? Are they more consolable? And if that child's not, you're going to seek medical attention. But no, fevers do not cause brain damage. The other one I hear is that fevers cause seizure. There is a difference. There is something called febrile seizures, which actually does run in families. Episode 34 of my podcast, the PedsDocTalk Podcast, is where I talk about this. But no, it does not mean that every fever causes seizure. So you want to make sure that you don't get wrapped up in that, because then you can over-medicate that child. Every fever, you're trying to keep it down, keep it down. Remember that if your child has no family history of fever seizures, you don't need to be doing that. And even if your child does have a family history of fever seizures, it's not always needed that you have to medicate and medicate. We'll do another episode on fever seizures, but definitely listen to that episode on my podcast if you want more information now. Another thing I hear is, if your child has a fever, put them in a cold bath or put cold socks on their feet. No, you don't want them to be so cold when they're actually hot. So the hypothalamus is involved in sort of regulating that body temperature. So if you're running a fever, the hypothalamus sees your body as a certain temperature. When you're trying to set that thermostat and you try to bring it artificially down with a cold, frigid bath, that's going to confuse your body, and then you're going to start to shiver and be very uncomfortable. So don't artificially bring down that fever with a super cold bath. Some things that you can do is a cool washcloth, so something lukewarm on the forehead. You can do a warm bath, nothing too hot, just because if you're too hot and then you take a hot bath, that can just be uncomfortable and cause them to shiver or cause them to just be very cranky. So keep the temperature just a little more comfortable. You can still bathe the child if they have a fever. You can do your obviously normal in-house routines. If your child does have a fever, obviously in the time of COVID, you don't really want to be taking them out to daycares or play dates or anything like that, because you want them to rest. You don't want them to spread, if they are fighting, obviously, any viral processes to others. So now we've talked about thermometers, we've talked about why kids get fever, we've talked about the myths behind fever. The most important thing now is when to seek medical attention, because like I said, not all fever is concerning. I would say 90% of fever I'm not worried about, but there are times where we are concerned. So the number one reason you should seek care is your child has a medical condition that warrants them to be evaluated for a fever. So you would know that. You would talk to your pediatrician, hey, my child has X, Y, and Z. If my child gets a fever, do I need to be concerned? Examples, a child with a single kidney, sickle cell disease, obviously any of our oncology, cancer patients, these are reasons that we would need to know about any fever, regardless of how many days, regardless if it's 102 or 101 or 100.4. So definitely talk to your pediatrician if you're concerned. Number two, I mentioned already, if your child is under 2 months of age, you want to get them evaluated for a fever. So don't go by forehead, don't go by the ear. The best core temperature is a rectal temperature. Now, parents often ask, well, how do I know if my little baby needs to have their temperature checked, or any kid in general? Under 2 months, it would be a very hot child or very irritable child with feeling hot, feeling the back of their neck, all of a sudden they're really sweaty. You can go ahead and check a temperature. So if it's over 100.4, you're going to get evaluated. Older kids, same thing. You can use your hand, like I said, as a gauge. Use the back of their neck or use the back of obviously your hand on the forehead, but check the back of their neck if they're sweaty and hot and also associated with any irritability in that older child, you can check a temperature. But in the under 2 months of age, because they may not always be super irritable, they just may be more sleepy, you really want to go by how they're feeling, and you also want to go by, hey, my child's acting a little bit off. They're normally feeding, but they're not. Just check a temperature to be safe. So now we talked about under 2 months underlying medical conditions. So now just say your child is older. I want you to always remember, I'm looking at first how my child is acting with that fever. So if my child is uncomfortable, inconsolable, unarousable, you normally waking up and just not, check a temperature if they're feeling warm to you, right? Make sure that it's not a fever. If they are having a fever and they're uncomfortable, you can give them medicine. And again, we'll go over the Tylenol dosing and Motrin dosing, or acetaminophen and ibuprofen. But you can give them medicine. An example of a kid who I'm concerned about, just say they're 101 at 12 p.m. You give them Tylenol. An hour later, they're still 101 and they're still cranky. You want to tell your child's doctor, hey, I want to get seen, or what should be going on. Definitely give your child's doctor's office a call, because that child, we want to be evaluated. We want to evaluate that kid who is uncomfortable despite meds, inconsolable despite meds, unarousable despite meds. The other child we want to see is a child who's dehydrated. So breastfed, formula-fed babies, if they're not taking breast milk or formula, not making wet diapers, at least 3 in a 24-hour period, let your child's doctor's office know. If your child is older, using the potty, if they're not obviously drinking and making urine, we want to know. If they're vomiting and not able to keep liquids down, we want to know. So that is the hydration piece. The other thing is, how are they breathing? So if they're breathing uncomfortably with the fever, please let your child's doctor's office know, get them evaluated. So when you're looking at a child with the fever, you're looking at those few things. How is my child looking? Are they consolable with or without meds? Am I having to give the meds every 3-4 hours and I'm due for another med and I can't give anything? Maybe a good idea to run it by the child's doctor, because something might be going on. My child's hydration, my child's breathing. Now, if all that is going well and the child's acting well, awesome. So the big question is, well, how many days of fever? Just say my 1-year-old has a fever. Many viruses can cause fever for 5 days and 7 days. I use a 5-day checkpoint. But that means that in those 5 days, you have to be comfortable looking out for those things I mentioned. How are they breathing? Are they hydrated? Are they consolable with or without medicine? If you're concerned, you need your child evaluated before that 5th day. That 5-day rule is in a child who's acting well, consolable, hydrated, and breathing comfortably. I cannot stress that enough. So if day 2, your child is not looking well, you are concerned, take that child in. Do not wait for 5 days. Your gut is also really important as a parent or caregiver. So if you are concerned, oh, my child's not acting well, we are here for you. We are open via telemedicine maybe, we're open via the offices, your ERs are open. It's important, if you're concerned, to seek medical attention. I hope this video was helpful. My goal of this video was to educate you about fever, make sure you understand when to be concerned, and make you understand that you do not need to over-medicate your child. Focus more on how they're acting. Understand the best way to check a temperature, which is again rectal under 3, and then also understand when to seek medical care. If you found this helpful, make sure to comment below. Hit that subscribe button so that you can stay up to date on all of the new episodes I release. Share it on social media, share it with a friend, especially a relative, an older relative, a nanny, a caregiver, a grandparent, because I get a lot of questions about this from grandparents. And also make sure to follow me at PedsDocTalk on Instagram and listen to my podcast, the PedsDocTalk Podcast,